you said that, how do you tease out whether a patient's injury is too inflamed to handle a higher percentage of dextrose versus a lower percentage? So we're calming down the inflammation versus inducing a little bit more inflammation. Is there something that in your physical exam that tells you that? Is it treatment, trial, repeat, or is it more intuition?
It usually goes back to the overall health of the patient. And so in a good example of this is, so patients at Roosevelt are generally not as healthy as the patients that see me in private practice. And so in private practice, it's pretty rare for me to drop down percentage and do a lower percentage prolotherapy approach where I'm doing 10, 12.5, 15% periarticular, and then a 20% intra-articular, because most of the people that come to see me are in decent health. You know, they don't have uncontrolled diabetes, or they don't have raging hypercholesterolemia or widespread systemic inflammation where their CRP is like 8 or 10. Whereas at Roosevelt, that patient population generally, you know, they do have more of those health-related issues. And so that is where we seem to be a little more cautious about our dextrose concentrations because of that. So if our physical exam is kind of just showing widespread pain, so, you know, not fibromyalgia, but where you're palpating and it's like, okay, everything just seems to hurt. It doesn't really, like, some things hurt more and some things recreate their pain, but there are certain things that, like, you just palpating the area, it's painful for them, and it's not really their pain. It's just painful because of the inflammation that they have in their tissues. That's a time when I would maybe scale back and say, okay, let's just start with 10% dextrose prolo, or let's try 5% intra-articular versus 20% or 25%. And then acute injuries, I tend to go a lot lighter on the dextrose. And so, you know, we're doing a lot of perineural after acute injuries, not so much prolo, but even at like maybe the 6-week mark after a rolled ankle where someone's still suffering from pain, then I might come in with like a 10% dextrose solution, just because they're still a little inflamed from that initial injury, and I just don't want to piss it off way too much.